Welcome back to the Morning Blend, advancing their care. Just last month, doctors at Mountain View Hospital performed the first cryoablation procedure in the Silver State on a woman who struggled with heart complications. It's been just over 2 weeks since that procedure. And here to give us the details on this major medical advancement that she went through is patient Sandra Sparks and Dr. Diraj Narula, a cardiologist and director of the Cardiac Rhythm Laboratory at Mountain View Hospital. Thank you so much for joining us.
Thank you.
Thank you.
Sandra, let's start with you. How long have you had heart complications?
For about 20 years,
Wow.
different types. This type really, they discovered in October. I was at the doctor's and they told me to go to the hospital right away. And then that's when they told me I had AFib. And they sent me to a cardiologist, Dr. Patel, and he referred me to Dr. Narula because it was an electrical problem.
Gotcha.
So you said that you've had this for about 20 years. What were some of your symptoms and some complications that you had?
What I was doing is throwing PVCs and having an irregular heartbeat, which was most of the time slow. But then it started going fast with this AFib and all. And I really started to feel it, you know. I would go up the stairs and I'd start sweating and all. And I noticed I didn't have a lot of energy. And I haven't been one who really likes to go to a lot of doctors and all.
Yeah.
But during this, I've had some wonderful doctors who I'm not afraid to go anymore.
That's awesome. It's only been 2 weeks since the procedure. How's the recovery been like? What was the process like?
The process was a little daunting. You go into this operating room and there's all these pieces of equipment and all these people standing around and putting all these probes on you and all. But I was out for most of it.
That's which is good.
And I really didn't feel anything from the heart. It was mostly from the throat and the esophagus where they had put a probe down my throat.
And now you're great. You're here with us.
I feel wonderful. You know, I went to Mesquite this weekend with family.
That's great.
I was able to walk without having to stop and rest. I walked so much this weekend, and it made me feel so good.
Life is so much better for you now. You're doing things that you hadn't been able to do
Yes.
before. Doctor, talk about this procedure and how this is so life-changing for people. And really, this is the first time you guys have performed this.
That's right. So cryoablation is a new procedure for management of atrial fibrillation. Atrial fibrillation is the commonest form of irregular heart rhythm. And it's really actually quite common. About 2.5 million people in the United States have it.
Wow.
About 30,000 people in Las Vegas alone, probably. 1 in 10 people over the age of 80 have it. And if it's not treated correctly, it can lead to stroke and congestive heart failure. A lot of people have symptoms with atrial fibrillation, and everybody has different symptoms. Some people don't feel it, but the majority either feel chest pain or shortness of breath, or they know that their feet swelling, or they have palpitations, or sometimes they faint from it.
So let's talk about cryoablation without getting too technical, obviously, for how this helps repair that.
Sure. So for Sandra's procedure at Mountain View Hospital, my colleague Dr. Michael Bensler and myself performed the procedure. What we did is we went in through a vein in Sandra's groin. We snaked a tube up to her heart. We located the area that was responsible for the irregular heart rhythm, and we froze that area using a cryoballoon instrument.
So when you performed this and you needed, you know, to get your first patient, so Sandra just then go wave her hand and said, I'll do it.
Sure.
To make a difference in her life.
Yeah, we've been trying to get this this equipment to Las Vegas for a while, and we were, you know, thanks to the administration of Mountain View Hospital, they were cooperative in getting that. So when we had it available, I talked to Sandra about how we had this new equipment available, and she was keen to go ahead with it.
Absolutely. Now, of course, we want everyone at home to have strong cardiac health. How can people maintain strong cardiac health to hopefully, you know, be of good health for the rest of their lives?
Well, I guess the most important thing is to eat healthy and have regular exercise. And if you're a smoker, you need to stop smoking yesterday.
Get a time machine and go back. Yes.
That's right.
Awesome.
And other than that, if you actually have a diagnosis of a heart condition or of an irregular heart rhythm, then you should be seeing a specialist on a regular basis. to find out what the status of the condition is and what the current treatment should be.
What a
Absolutely.
life-saving procedure.
No
Thank you
question.
so much for sharing your story.
It's a pleasure.
Thank you.
So much, and thank you for the work.
Thank
that
you for
do.
having us.
Dr. Narula's office is located on Banbury Cross Drive. If you'd like more information about Healthcare Partners Medical Group, you can call the number or check out the website on your screen. They're also on Facebook.
Still ahead in the